What skills you think you had that helped with this transition, that helped it smoother?
I guess, being a doctor, I think we're smart people. We're intelligent. We're not afraid of hard work. We're used to long hours. And a lot of this business is actually not just working at the business. A lot of the business is developing marketing protocols, policies, ordering product. So, I mean, a lot of it is just a lot of hard work. So definitely residency and even as an ER doctor now, you have to buckle down and work hard. And I think that was a skill I developed through my training.
Hi, Barbara. How are you?
I'm great. How are you?
I'm good. It's so good to see you again. I am excited about our conversation today.
Thanks. Me too.
Right. So I know that we spoke in a previous episode that was about utilization management, careers in utilization management. But I wanted to talk to you about your new adventure, Show MD. So tell us what led you to creating Show MD.
Sure. So Show MD is the first mobile medical clinic that provides on-site care for equestrians. I'm a competitive rider. I've ridden my whole life since I was about 7 years old. And I've gone to horse shows ever since I was, a little kid. And it's a really great sport. It's really fun. A lot of people don't really know much about horses or jumping or what we do because it's not mainstream like, football or soccer. But it's a great sport. It's a really fun industry. And it's just a great thing to do. I mean, you get to ride horses, be outside, have a bond with an animal, and it's really a great part of my life. And I'm an emergency medicine doctor. I've been practicing for many years, way too long. And I started, people started finding out I was a doctor at horse shows, and they would ask me, questions, and, I felt like I should help them in a sense, give them some advice, help them here and there. I started carrying like a knapsack and my stethoscope to some horse shows and helping people. But I didn't really have any formal documentation. I didn't really have a way to keep medical records. Once in a while, if I'd prescribed some antibiotics or something, I would just write like a Word document and keep it in my computer, and I would call in a prescription. And, people kind of got, the word got around, and people started, coming to me more and more. And I thought to myself, well, gosh, this probably is a service that people need. And there was definitely people that I was friends with and people that ran horse shows that told me that they would be very supportive if I started this kind of business. So, finally, I basically took the leap, and I bought a mobile medical clinic that I can drive. And I opened my doors, believe it or not, right in 2020 when COVID came.
Oh, a mobile clinic. How fun, huh?
It's great. It's amazing.
I'm sure. What were some of the challenges that you faced when starting the practice and then running it?
Sure. Well, the biggest challenge I had was that COVID came and basically shut down everything. So I remember I had gone to Arizona in 2019, and I, kind of set up how I wanted the truck to be and how the rooms were going to be and what was going to be in it. And I think it got delivered like literally at the end of March or April of 2020. And I thought to myself, oh my gosh, what am I going to do with this? I have this clinic. Everything's closed. It was actually kind of good because it gave me a little time to sort of figure out, how I was going to run it and who I was going to hire and what horse shows I was going to go to. And I was very lucky actually because they allowed horse shows to open because they were outside. And I think we could return to competition in May, which was nice because it was like, a lot sooner than many other indoor activities. So I went to the first horse show in May, and there was definitely limited people there because of all the rules and regulations. They didn't let spectators in. So the number of people that attended the horse show was, not as many as there are now.
So what does your typical day look like? What is your schedule like?
Sure. So horse shows typically run from Wednesday through Sunday. And usually we go to about 2 or 3, sometimes 4 weeks of shows per month. It just depends kind of on the month and the calendar. And I say we because I've developed a really great team of people. I have one nurse or one paramedic that usually works with me in the actual trailer. So before the horse show actually starts, we have to bring the mobile clinic to the horse show and set it all up. We have to set up the inside because you can't drive like the equipment with it, out. You have to have everything in the cabinets. And then when we get to the horse show, we set it all up. So we usually do that a day or 2 before it starts. And then we generally open from about 9 to 5 at the horse show. Sometimes people will text me or ask me if I can, open a little earlier or stay a little later, and that's fine. And we're pretty much there for walk-ins, just like any urgent care. So if people fall off their horse or get injured, or if they are sick, or if they really have any, medical need, they come over and they check in and they see me, and we, do their care.
Awesome. That is a really amazing story. You have a really amazing story. I'm impressed. What skills you think you had that helped this, with this transition, that helped it smoother?
I guess, being a doctor, I think we're smart people. We're intelligent. I think we are, we work hard. We're not afraid of hard work. We're used to long hours. And a lot of this business is actually not just working at the business. A lot of the business is working, developing marketing, developing protocols, developing, policies, ordering products, So, I mean, a lot of it is just a lot of hard work. So definitely, residency and even, as an ER doctor now, you have to buckle down and work hard. And I think that was, a skill I developed through my training.
Yeah. And are there any skills you hope residency or maybe medical education would have taught you to prepare you better for, being an entrepreneur?
Yeah. How do you square to check people out on No, I mean, residency and med school, I guess, I did it a long time ago. I'm actually pretty old, but I don't know what they're teaching now. But I think, how to run your own practice and how to develop a business, I think is really important. I mean, I didn't even know how to set up my S Corp. I didn't know how to do QuickBooks. I didn't know how to do a lot of that stuff. So, for me as an ER doctor, I basically started my own practice. And ER doctors, typically, we don't have an office. We work in the hospital. And a lot of stuff's kind of like, taken care of. But I had to pick an EMR. I had to get malpractice. I had to hire staff. I have to run payroll. So all that for me was, learning. But I think, I don't think doctors really get that training as they go through really their medical school for sure, and even residency. So I actually started, for the residents I work with at the hospital, I started a whole, it's like a 2-week online learning program of like how to, start a business, like what skills you need.
Yeah. And what are some ways you used to grow your practice? You used or you are using to grow your practice?
So that's been, challenging in terms of, what works. Definitely, I've done a lot of social media marketing. So I've done some Facebook ads. I'm actually friends with a lot of my patients. I mean, this is like very atypical for a doctor.
Mhm.
But I'm friends with Facebook patients. They're friends with me, at the horse show, and they'll share my information, and I'll get texts and phone calls, and people will, call me and ask for telemedicine consults because their friend referred them to me. A lot of it's word of mouth. A lot of it's just, being there at the horse show and interacting with people and talking to people. So it's probably a little less traditional than any other medical practice.
And then the pay structure, is that insurance? Do you take insurance, or is it cash?
I don't take insurance. I take cash only. I am, I guess, fortunate to be in an industry where people have, good incomes. I mean, you have to have a good income to afford a horse. I don't charge exorbitant amounts of money. But I still have to keep my doors open and pay my staff and pay my bills. But yeah, I don't take insurance, which is nice because I just don't think I would survive if I actually had to process insurance claims.
Yeah. What advice would you give to somebody who is thinking about transitioning out of clinical medicine into entrepreneurship?
Well, I mean, I think, I'm still doing clinical medicine, but I'm also running a business. I do have 2 PAs that work for me. So I think, you have to believe in yourself, and you have to, believe that if you're passionate about something and you're interested in something, that you can do it. And I think you just have to, really have courage.
Have you thought about mentoring other physicians and starting such practices?
I mean, yeah, with the residents I work with, I try to help them to understand about, being an entrepreneur and developing yourself. I actually recently gave a lecture on sort of how to develop yourself as a brand, how to promote yourself, even if you're working for somebody else. So I really try especially with the residents I'm working with.
Yeah. Where do you see yourself in 5 years?
I'd love to have a franchise with this business. The equestrian industry is very, popular across the whole country. There's definitely other states I'd like to expand to, and I'm working with my marketing person right now on a franchise package.
That sounds awesome. Thank you so much for sharing your journey, and hopefully we can get you back some other time and learn more about your progress as you go.
Thank you. I'd love to come back.
All right. Thank you, Barbara.